Now, you shared with me why you're here, and I would like to take a few minutes to share with you exactly why I'm here and why I chose to do this kind of work. It's all because of my family. It's my wife, Linda, my son, Dylan, and my daughter, Caitlin. The kids aren't thrilled with these pictures because they're baby pictures. But this was back in 2001. Now, raise your hand if you remember 2001, particularly September 11th, 2001. Right? Unless you're living under a rock, we all remember that day. I remember exactly where, we probably can all remember exactly where we were, right? When we saw those images on TV, those horrific images. My wife and I were actually at the gym doing the stair climber side by side, watching the TVs, and our jaws just dropped because we're originally from New York. I have friends who died in those buildings. She had friends who died in those buildings. Her cousin was one of the only surviving firemen who now actually leads the tours at the memorial in New York City. Okay? When we saw those buildings coming down, we thought this had to be the most horrific thing that could possibly happen. Thousands upon thousands of people dying right before our eyes. It was just incredible. And I thought that was probably the worst thing that I could imagine happening. However, 1 month later, my belief changed. 1 month later, in October of 2001, is when we got the phone call that said that lump in Linda's breast was cancer. It was right before Thanksgiving. Right? It was the very end of October, it was actually around Halloween, I should say. We were actually making our Thanksgiving plans. We were talking about my family coming down, and I remember Linda was making dinner, and when I got that phone call, she saw my face, and she just dropped the knife. She knew what it was. What was scariest to me at that time was that we found out that this was potential breast cancer. I said, what is potential breast cancer? And I said, well, we've got a lab result that says that that lump that Linda has had in her breast for 10 years was cancer, but we could not tell if it was invasive or not, had it spread. So I said, well, let's send that same sample to another lab. They sent it. That lab sent back a report saying, not only has it not spread, it's not even cancer. I said, okay, now I'm confused. Send it to a third lab. I need some kind of consensus. We sent it to a third lab, and the third lab said, not only is it cancer, it's fully invasive. Right? What are we supposed to do with that information? How confusing has our medical system become? Okay, here's something that we think should be pretty much cut and dry, right? Should be black and white. You look under the microscope, is it or is it not? Well, I got a very quick lesson in the fact that we don't know a whole lot. Okay? A lot of it is still guessing and conjecturing. It kind of like this, maybe it is, maybe it isn't. Let's go with what most people will agree with. Okay? And then we base protocols of treatment on that, right? Maybe it's right, maybe it's wrong, maybe it's not even the right diagnosis. So we went back to our surgeon and he convinced us. He said, look, we got 2 out of 3 that says maybe it is. So why don't we go ahead and remove that lump just to be on the safe side? And we said, okay, that makes sense. Let's do that just in case. Even though it had been there for 10 years, it never changed. And we really didn't, in my heart of hearts, I really didn't think it was anything that could be bad if it was there that long. But let's go ahead and remove it, which we did. And then, of course, they want us to go through the regular hoops of talking to the oncologist in regard to chemotherapy and radiation therapy, which, as we know, are the hallmarks of cancer care in this country, right? We cut it out, we poison it, we burn it, right? So we went to speak to the oncologist. The oncologist at first started talking about wanting to give Linda tamoxifen, which, is anyone here familiar with breast cancer or the use of tamoxifen? All right, tamoxifen is a biological agent, a type of chemotherapy that acts on enzymes that allow estrogen production to grow or not to grow. And you might know a lot of female cancers are driven by estrogen because estrogen is a growing tissue in the body, right? Just like testosterone is. And so because it's a steroid anabolic growing tissue, it can make abnormal tissue grow faster. And so they want to use this medication that stops our body from making estrogen in order to stop this cancer from growing. So of course, before I went, I did my homework. I come from a research background, so I could ask intelligent questions. And I said, okay, before we initiate this, how long do we want to take it? 5-year minimum. I said, okay, and what are we looking to achieve? Well, it's going to reduce the risk of developing cancer in the opposite breast by 50%. I said, wow, that sounds pretty promising. In how many people? So he looked at me kind of funny. And he said, well, let's look at the data. In 13% of the people who take it. Wow. I said, okay, so let's talk about what we know it will do. That might help, it might not. What will it do? Well, we know it will increase our risk of stroke. We know it will increase our risk of ovarian cancer. Okay? Stop one and start another. I said, does that make any sense at all? I'm starting to get a little wishy-washy about this. And they said, last question. Linda's 33 years old. In all the research I found, tamoxifen was never tested on a woman under the age of 50. Right? Because up to that point, breast cancer was considered a cancer of menopause. It happened when your hormones started changing. And so I said, what data do you have on me to show me how it's going to react in a 33-year-old woman's hormone balance? Because we can all agree that hormone balance of a 33-year-old is a lot different than a 50-year-old, right? And he said, we have no data whatsoever. It's never been studied. We have no idea. I said, but you can prove that it's going to be damaging and harmful. I said, does that make any sense to you? And he looked at me and said, you know what? She shouldn't take it. All right? You have to be your own best advocate. You have to present questions. They then said, but, of course, you have to talk to the radiation oncologist. So we went to the radiation oncologist, and she started talking all about how we absolutely, positively had to get radiation done because even though we removed the tumor, there's absolutely no way that you get all the cells. And that's true. All right? Anyone who's ever had cancer or no one who's had cancer, does it ever come back? Right? It almost always comes back within just a couple of years. Right? Usually within 3 years, 90% of cancers return that were considered to be in remission. Why does it happen if we think we got it all? Because we never get it all. Because what we don't see are the cancer cells known as stem cells, which are the baby cancer cells that have already gone to the bloodstream. They're what we call circulating tumor cells. And in our new technology, one thing that they do is usually run a blood test to look at your circulating tumor cells to see what's still going on away from the little thing that we can see that we removed. Okay? So she wanted to do radiation. And I said, okay, but my concern is this. Does radiation not cause cancer? Well, yes, it does. Right? And in that kind of situation, do we know for sure if we even have cancer here? No, we don't. And so, well, I've got some problems with that. I've got some issues with that. Why would we choose a treatment that we know causes cancer? We're not even sure we have cancer in the first place. She didn't like that. She put her hand up in front of my face, up like that, the universal symbol for shut the hell up. Right? Stood between me and my wife and said to her, if you listen to him, you'll die. If you listen to me, you'll live. Which one do you want? Can you imagine the position that put her in? Now, I've never hit a woman, but I wanted to then. Okay? I was not happy. I was appalled that she would even say that and put her in that position instead of trying to talk logically about the issue. Okay? This was a fear tactic because she wanted her way. Well, my wife burst into tears. She didn't know what to do. She turned to me and she said, you know, I love you and I trust you, but you're not an expert in this field. And I'll tell you, I wasn't then, but I am now. I have to, as she said, defer to the experts. And I said, you know what? It's your body, not mine. You do what you think is right, and I'm going to support you in whatever your decision is. Even in the back of my mind, I was saying, please, please, please don't do this. But she decided to do it. And she went at this time to get radiation daily for 6 weeks. She would drop the kids off at preschool, and she would go every day, and she'd get radiation therapy, which burned her skin, which made her hair fall out, and made her throw up every day. But the doctor said, well, it doesn't have any side effects. It can't be. I said, well, it happened the day she started doing it, and happened every day since, so don't tell me it can't be. All right, just because it doesn't fit the textbook normal. So they said, okay, let's go through all this radiation therapy, and we're going to keep doing mammograms. More radiation, right? And we're going to do them at first every 3 months. Then we're going to do them every 6 months. Then we're going to do them every year. And if you go through 5 years of not having a recurrence of an obvious sign of this cancer, we're going to consider you cured. They don't use those words very easily, right? So 5 years went by, and we didn't have it returned. So we thought, holy cow, this is awesome, right? I wanted to have a big party. But Linda could not let it go. She had fear in the back of her mind every single day. She was not ready to put that down. Linda was the toughest woman I ever met. From a girl from Brooklyn, New York. You don't mess with her. I learned that the hard way many times. Okay? But I found her crying every single day for years. Fear about, did we get it all? Will it come back? Did I give it to Caitlin? Right? And I can understand those fears. It was just a horrific time in our lives to go through and see this. It got even more horrific 10 years later, 11 years later, in 2011. This is when something strange started happening to Linda. And she started to say, I just don't feel right. And we started to notice that her breast started to become more tender. As a matter of fact, at one point our dog actually jumped on her and hit her right in the breast where she had the lump removed, and that pain did not go away for months. So I dragged her down to the doctor and said, we've got to get this looked at. Something's not right. And when they looked at her, they found a big blood blister under the surface, a hematoma. And they said it was from the trauma of the dog jumping on you. We usually don't see this unless you get like in a car accident or something really significant, but it must have been from the dog. Come back in 3 months, it should be gone. We came back in 3 months and it was bigger. They said, okay, well, you have a lot of scar tissue in there from the old radiation we did. So maybe it can't reabsorb the tissue the way it normally should. It couldn't reabsorb the blood. So come back another 3 months. We came back in 3 months. Instead of it being 1, there were now 3. And they said that's completely normal. The first thing that happens is it breaks up and it gets smaller so the body can reabsorb it. Come back another 3 months. Here we are a year later now, right? So we come back another 3 months, and actually 2 days before that visit, Linda took off her bra and I saw a big purple blood blister mass coming out the side of her breast. And she had known it was there and was coming through, but she was so shell-shocked by her whole experience that she dug her head in the sand and didn't tell me. She would just hide herself. When I saw it, I said, what the hell is that? And she said, oh, it's been there for about a week. Okay? So I said, well, we're not waiting 2 days, we're going right in. We went right in, they did a biopsy, and they said, don't worry, we'll have our results in just a couple of days. A couple of days went by, a couple of weeks went by, 7 weeks went by. And we did not have an answer. Can you imagine the anxiety in my house? I'm getting anxious thinking about it. Finally, we get the phone call from the doctor who said, I'm so sorry it took so long. This was a unique situation. We had to send these samples around to 7 of the major cancer centers in the United States to try to get consensus. And they finally all agreed this is a horrible beast of a cancer called angiosarcoma, and it was caused by the radiation therapy we gave her. It's secondary to radiation. I was just a little pissed off. So instead of ranting and raving, I said, okay, we understand what the problem is, what's the game plan? And they took me aside and said, the game plan is you go home and get ready to die. He said, because 90% of the people will die within 2 months of first finding any sign of this, and you found it a year ago. 7% of people will die within 2 years. 3% of people we consider this success because they lived 3 years. And no one lives beyond that. So they all threw their hands up in the air and refused to do anything to help. They said, that's it. I wasn't willing to accept that, as I don't think any of you would be here. Right? So after lots of arguments and going back and forth and yada, 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 no one would help us. They dragged the time out and out and out. And it turned out that this cancer eventually spread to every part of Linda's body. It was in every bone in her body except for 2 vertebrae. It was in both her ovaries. She had 9 tumors in her liver. She had a tumor the size of a volleyball in her pelvis. And it was in the covering of her entire organ systems. It was everywhere. And you can only imagine, with all the cancer through your bone like that, the bone's expanding and breaking. We'd be sitting at the dinner table, she would pass, the salt, and her ribs would break. And she would scream, and she was tough, tough, tough. And she'd go right back to the conversation, right where she was. Okay? It was crazy. You might notice in this picture, here we are, notice the date. 3 years later. Whoa. Sorry. 3 years later. Right? When was she supposed to be dead? Right? What I had done is I was not willing to give in. So I said, okay, just because you don't know how to do something doesn't mean that no one knows how to do something. Right? Just because our FDA only allows certain things to be done in this country doesn't mean things aren't done differently outside this country. So I have my own particular view of cancer and my view of how it starts and how it should be stopped. And it has nothing to do with the tumor. It has everything to do with the immune system. Right? We treat cancer in this country the same way we treat pimples. So here's this growth we don't like. So maybe we put some drugs on, some chemotherapy, and try to make it go away. If that doesn't work, we hit it with some UV light and try to irradiate it. We use radiation. If that doesn't work, we finally cut it off. Okay? But what actually causes the pimples? Well, that happens 10 steps before, right? That's the dietary problems, the emotional stress, the things that change our hormone balance, that create oil secretions, that lead to these changes, right? Possibly exposure to certain toxins or medications that disrupt the way our body works. Well, it's the same way with cancer, right? It's not the tumor or the aberrant cell. It's this 10 steps before that, where something went wrong with the immune system, where it was not able to recognize the cancer to stop it, or it was not strong enough to do the job. So I focused my research on that. And what I started to do is I didn't want Linda to get upset or nervous or worried. I didn't want her to think that anything was wrong. By the way, I never let her hear what the doctor said. She never knew how much time she was supposed to have. I was told from day one, this is a bad situation, but don't worry, we're on it. Okay, we're going to figure out a way to help you. And she didn't have a lot of faith in the doctors anymore. And I said, I'm going to run point on this, and I'm going to get these guys to help me, not the other way around. Okay? And that's what we did. So I started slipping out of bed in the middle of the night when she was sleeping. I would sleep 2 or 3 hours, and I would go downstairs and go on the computer, and I would study for anywhere from 5 to 8 hours every day for 5 months straight, looking at immunotherapy treatments from around the world. And I found 500 treatments that showed some promise. I narrowed it down to 50 that I thought were the best, most reproducible, the best research. I narrowed that down to a dozen that I thought I could actually do this at home. Because was I going to get help from traditional, conventional medicine? No, right? So I started using these therapies with her, and she started to improve. Her blood work turned around and started to normalize. Her pain started to go away. She started to come back to life instead of just sitting on a couch all day long, not being able to move. She wanted to go out shopping. She wanted to go out and have fun with her friends, right? So things started to get better. At one point, we had a barbecue for our friends, and after everybody had left, Linda was sitting in her favorite chair watching TV, and I was washing the dishes. And suddenly, she let out a blood-curdling scream like you'd never heard before. And she just kept screaming and kept screaming. I ran right over to her and I said, "What's wrong?" And she was looking right through me like I wasn't there, saying, "Someone help me, someone help me, someone help me." And she couldn't even see me. She started clawing at the walls and was ripping her own fingernails off. Obviously, I knew something was wrong, right? Something had changed from 5 minutes ago when she was laughing and having a good time. She finally focused on me, grabbed me, and said, "You have to kill me now." She said, "This pain is unbearable." What had happened was she was on multiple types of narcotics, the strongest stuff you could be on, orally, injections, and transdermal patches, in order to control the pain she was having from all this cancer throughout her bone. And she reached a point where her brain and nervous system said, "No more. We reject this." And no longer allowed the medication to come into her brain. All the pain flooded her at once. It was like getting hit by a bus and being run over back and forth. So I rushed her to the hospital where they tried to modulate her pain. And on a 0 to 10 scale, for us, she was probably at a 15. And they got her down to about an 8, and she thought that was wonderful, right? And that would last a couple of hours, and then start going back up again. So we had to keep playing this game of trying different drugs and trying different combinations and trying to switch things around because her brain just kept rejecting. Now, she was in the hospital for a full week, and I was not able to do any of my immunotherapies with her because they wouldn't let me do it in the hospital. And part of her treatment induced a strong reaction from her immune system. So she had a fever of about 102 to 103 every day for the month before we went to the hospital. Okay? She was throwing up over and over. Now that sounds very uncomfortable, and it is, but that's a sign of a properly functioning immune system. Okay? It's trying to kill something and get it out. A week into her care in the hospital, her fever broke, and everyone in the hospital got all excited. "Oh, thank God, her fever broke." I said, "What are you talking about? That's the worst possible thing that could happen. It's the first sign that her immune system is giving up." And they all looked at me kind of like my dog looks at me, right? "What are you talking about?" I says, "No one remember basic physiology? What is a fever? It's what the body uses to initiate the immune system cascade. Okay? It releases calcium from your muscles when you shudder so you can feed your immune system. It raises the temperature to kill off invading organisms. It serves a purpose." They all went, "Oh, that makes sense." And they all looked at her and said, "Oh, her fever broke." Over the next week, I watched her get worse and worse. I asked for all of her blood work from every day and looked at it, and I saw her blood work going downhill, day by day by day. I finally saw her liver shut down, and then saw her kidneys shut down. Now, did you guys notice in the pictures? Let me go back for a second. Do you notice a difference between the picture of her standing with the kids earlier and then the picture here? Look at her face. Look at the difference. Do you see something different there? Mm-hmm. Right? Is she thinner in one and heavier in the other? Mm-hmm. So in a matter of just a couple of years, she gained 75 pounds that no one could explain. Mm-hmm. No one had any idea what was going on with her. They just told her, "Work out more and eat less." And we walked out of the office. She said, "If I get it one more time, I'm going to personally go back and go postal." Right? It was not a matter of exercise more and eat less, okay, because she did that, believe me, all right? But she kept gaining more and more weight. Not one doctor had an answer for her. Well, when she was in the hospital for those 2 weeks, it suddenly dawned on me in the middle of the night. I was sleeping next to her because I would never leave her side, which no one should ever leave anybody's side in the hospital, I'm telling you right now, okay? So I would just stay there until my son could get there. I'd run home, take a shower, come right back. But in the middle of the night one night, it just dawned on me, the majority of the symptoms that she's having excess weight gain for no apparent reason. Her skin's getting dry. She kept telling me my hair's falling out. She had overwhelming fatigue. Sound familiar? Mm-hmm. Right? She had constipation. Her sex drive started to wax and wane. Right? And it just dawned on me, oh my gosh, she's got hypothyroidism. The thing I help everybody with. Right? But I couldn't see the forest through the trees because I was so caught up in the cancer, as every other doctor was. So in the middle of the night, I went and asked them to do a blood draw, and I asked them some very specific tests. And they couldn't understand why I was asking for those, because no doctor asked for these, but I did. In the morning, I came in, and man, were the results outrageous. Everyone here familiar with TSH? Thyroid stimulating hormone? So if you ever get blood work done for your thyroid, they're looking at your TSH level, right? And does anyone know what a normal is supposed to be? They say anywhere between 0.5 and 5.5, depending on the lab you look at, 4.5, 5.5. So 0.5 to 5.5. Linda's was 278. Think she had a problem? Right? And no one had picked up on this before. So her oncologist came in the morning and he said, hey, someone ran thyroid profiles on her. I said, yeah, that was me. He said, why would you do that? So I explained and he said, wow, I didn't think about that. I said, neither did I. Right? Because we're all caught up with that gorilla in the room, the cancer. So he said, well, great, I'm going to get her some Synthroid. And I said, oh, no. No. That's the worst possible thing you could do. He said, what are you talking about? Synthroid fixes thyroids. I said, well, in 1 out of 27 different types it does. And he looked at me like I was crazy because he had no clue what I was talking about. And I said, I know this isn't your field. Can you get me an endocrinologist to talk to? And he said, nope, they don't come to the hospital. I said, what do you mean they don't come to the hospital? I said, did you never have diabetic emergencies? He said, well, we just handle that in emergency medicine, and then we ship them out to the endocrinologist a couple of weeks after they're out of the ER. I said, well, I need someone who understands what I'm talking about right now. And he just couldn't get it. I said, okay, let me just take you through the steps. And I started explaining the physiology about why that would actually hurt her more than help her with her kind of hypothyroidism. And he just looked at me and he said, I'm sorry, this is over my head. I'm just going to give it to her. And he walked out with it. So then I had to stand guard. And every time the nurse tried to give it to her, I had to grab it and say, no, let me explain to you why, and dump it in the toilet. Finally, they just walk in the room and hand it to me, there you go. And I would dump it in the toilet because they understood. Okay? So the reason I'm talking about cancer tonight is because of what Linda went through and what I learned about hypothyroidism more so than what I knew before. What I learned about cancer, much more so than I learned before. And notice, here's one person who had two things, right? You have to realize that all your hormones work in conjunction with each other. Hormones are the communication system of your body. And when one hormone gets out of balance, it will affect the balance of all other hormones. And there are some key systems that work together. Your thyroid, your adrenal glands, your sex glands, testosterone and estrogen, and your insulin and pancreas, very tightly woven together. And when one goes out of balance, it's going to affect all others, and we're going to develop problems in all these areas given enough time. Now, in Linda's situation, we knew that her sex hormones were involved with the cancer, but also her body's ability to take in sugar and be able to use it. Her body's ability to handle stress was being dramatically affected by her hormones. And it was all driving her cancer. But at the same time, it also drove hypothyroidism. Because there is a commonality. There is something that these things share that is at the core of hypothyroidism, is at the core of cancer. It's also at the core of heart disease, dementia and Alzheimer's, diabetes, various autoimmune diseases such as rheumatoid arthritis, MS, lupus. They all stem from the same common denominator. That's called inflammation. Specifically, cellular inflammation. And we're going to talk more particularly about that tonight, about what causes it and what cures it. Because if this is the middleman that causes all these problems. Wouldn't you like to know how to get rid of that? And let me give you a little hint. Taking NSAIDs, non-steroidal anti-inflammatories like ibuprofen, Nuprin, Advil, Motrin, causes more inflammation inside your body. Nice little catch-22. They cause damage to a particular part of your body that drives inflammation through the whole rest of the body, and I'll talk about that tonight. So that is not the answer. Don't go home and start overdosing on that stuff thinking you're going to cure your cancer. Okay, or you're going to cure hypothyroidism, or your heart disease, or your diabetes. That is not the answer. Out of the pain that I went through with Linda, it ignited a passion in me to be here in front of you. Here's my dog Rocco, who also wouldn't leave her side. He's the one you remember who actually first found that cancer when you hit her in the breast saying, "Look, Mom, look here." And here he was the day before she died. She died 1 year ago, October 1st. That's why I'm here. Okay? I'm here to make sure that doesn't happen to any of you. Because I'll be damned if we let one problem steamroll into another because no one taught you it's all connected. I'm going to teach you how to change that. You guys with me? Mm-hmm. All right? Let's do that.